There is a virus circulating right now that carries a 50% mortality rate. Half the people who contract its most severe form do not survive. It has no vaccine, it has no specific cure, and it has just killed passengers aboard a cruise ship in a way that is sending a very clear message to anyone who travels, anyone who spends time outdoors, and anyone over 60 whose immune system and kidneys are already working harder than they were 20 years ago. The most dangerous part of this virus is not how deadly it is. The most dangerous part is how quietly it begins. It starts with what feels like an ordinary flu, fatigue, a mild fever, muscle aches, the kind of thing most people over 60 dismiss as a bad few days and try to rest through at home. By the time the real symptoms arrive, the breathlessness, the collapsing blood pressure, the kidney shutdown, the window for intervention has narrowed dramatically. I'm Dr. Matthew Carter, and I want to walk you through exactly what this virus is, who is most at risk, what the warning signs look like in the critical early days, and what you should know before your next trip, your next outdoor activity, or your next conversation with a doctor who may not have brought this up yet. If this is your first time on this channel, subscribe now. We cover evidence-based health information specifically for adults over 60 every single week. The kind of information that doesn't always make it into a routine appointment. We are talking about Hantavirus. You may have heard the name this week in connection with an outbreak aboard a cruise ship called the MV Hantavirus, which departed from the southern tip of Argentina in early April. Several passengers have died. More cases are under investigation. The World Health Organization is monitoring the situation actively, but here is why this matters far beyond one cruise ship. Hantavirus is not new. It is not exotic. It is not something you can only encounter in remote jungles. It is present on every inhabited continent. It lives in ordinary rats and mice, and the conditions that allow it to reach humans are far more common than most people realize, including conditions that many seniors encounter during home maintenance, gardening, traveling through rural areas, or staying in accommodations that have not been rigorously inspected. Let me start with the basic biology, because understanding how this virus works is the key to understanding why it is so dangerous, and why doctors often miss it in its early stages. Hantavirus is actually a family of viruses. Roughly 20 species have been identified by the World Health Organization. Different species are associated with different geographic regions, and they produce two distinct and serious illnesses in humans. The first is called Hantavirus pulmonary syndrome, which primarily attacks the lungs. The second is called hemorrhagic fever with renal syndrome, which primarily destroys the kidneys. The mortality rate for Hantavirus pulmonary syndrome, according to the Centers for Disease Control, is approximately 38%. More than 1 in 3 people who develop this form of the illness will die from it. The mortality rate for hemorrhagic fever with renal syndrome is even higher, around 50%. These are not numbers from a century ago. These are current figures from a virus that is actively present in the environment today, with no licensed vaccine available in most of the world and no specific antiviral treatment proven to eliminate it. Now let me tell you something I want every senior watching this to fully absorb, because it is the piece most often left out of the general reporting on hantavirus. The virus spreads primarily through rodents, specifically through their dried urine, droppings, and saliva that become airborne particles when disturbed. You do not have to see a rat. You do not have to touch one. You simply have to breathe in the disturbed particles from a space where rodents have been present. A garden shed that has not been opened since last autumn. A vacation cabin that sat empty through the winter. A storage room in a building with a rodent problem that was never properly remediated. A hiking trail through an area with high rodent density. These are not unusual situations. These are the circumstances of ordinary life for millions of adults over 60 across the United States and around the world. And here is where the situation on the cruise ship becomes critically instructive. The MV Hantavirus departed from Ushuaia, Argentina, a gateway to Patagonia, one of the most spectacular wilderness regions on Earth and a popular destination among older, experienced travelers. The first 2 fatalities were reported to be a Dutch couple who had traveled through South America before boarding the ship. Argentina and Chile are home to a particularly dangerous strain of the virus known as Andes virus. In late 2018, an Argentinian outbreak of Andes virus was traced to a single infected individual at a social gathering. That one person led to 34 confirmed cases and 11 deaths. What makes Andes virus particularly alarming compared to other hantavirus strains is this. While most hantavirus variants can only reach humans through direct contact with rodent material, Andes virus has demonstrated the capacity for human-to-human transmission. A person infected with Andes virus can, in certain circumstances, pass the infection to someone in close contact with them. That is relatively rare, even for Andes virus, but it is the reason why a cruise ship environment, a confined space with shared air systems, shared dining areas, and close proximity among hundreds of passengers, represents a scenario that public health officials are watching very carefully. Now I want to spend a moment on why older adults face a specifically elevated risk from this virus. And I want to be direct about this, because it is not something stated clearly enough in the general coverage. As we age past 60, our immune response becomes measurably less efficient at identifying and mounting a rapid defense against novel viral threats. The inflammatory response that helps younger immune systems fight off serious infections becomes both slower and, paradoxically, more likely to overreact in dangerous ways, a phenomenon clinicians call cytokine dysregulation. In hantavirus pulmonary syndrome specifically, much of the lung damage is not caused directly by the virus destroying tissue. It is caused by the immune system's own inflammatory response flooding the lungs with fluid in an attempt to fight the infection. This immune-driven lung damage is often more severe and less controllable in older adults. Additionally, hemorrhagic fever with renal syndrome, the kidney-destroying form of the illness, hits with compounded severity in adults whose kidney function has already declined with age. After 60, the average person has lost a meaningful percentage of their kidney filtering capacity compared to young adulthood. Add a viral assault that targets kidney tissue directly, combined with the low blood pressure that characterizes severe hantavirus illness, and you have a situation where a 68-year-old patient is facing a significantly more dangerous trajectory than a 30-year-old patient with the same infection. Let me walk you through the symptom timeline, because this is where lives are genuinely saved or lost. The early symptoms of hantavirus infection typically appear between 1 and 5 weeks after exposure. That wide incubation window is part of what makes it so difficult to trace and diagnose. In those early days, the illness presents almost identically to influenza. Fatigue that feels heavy and unusual, fever, muscle aches, particularly in the large muscle groups of the back, thighs, and shoulders, headache, chills, sometimes nausea or an upset stomach. For the vast majority of adults over 60, those symptoms would trigger a straightforward self-diagnosis of a bad flu or a summer cold. They would rest, hydrate, perhaps take acetaminophen for the fever, and wait it out at home. And then, typically between 4 and 10 days after those flu-like symptoms begin, the illness pivots sharply. In hantavirus pulmonary syndrome, the lungs begin filling with fluid. The breathlessness that develops can progress from mild to severe within hours. Blood pressure drops. Heart rate becomes erratic. Without intensive medical intervention, oxygen therapy, mechanical ventilation in serious cases, the respiratory failure can become fatal very quickly. In hemorrhagic fever with renal syndrome, the late-stage symptoms include a sudden drop in blood pressure, signs of internal bleeding, and acute kidney failure. Urine output drops dramatically. Waste products that the kidneys would normally filter begin accumulating in the bloodstream. Dialysis becomes necessary in severe cases. The critical window for intervention, the period when supportive medical care can most meaningfully affect outcomes, is narrow. And that window is most likely to be missed when the early flu-like phase is dismissed as something ordinary, which is exactly what happens in the majority of cases. This is not a criticism of patients, it is a structural problem. Without a specific test ordered early, and without a doctor who thinks to ask about recent travel, outdoor activities, or potential rodent exposure, the early hantavirus presentation is clinically indistinguishable from seasonal influenza. The test that confirms hantavirus infection is called a PCR test, the same molecular biology technique used widely during the COVID pandemic. It can identify viral genetic material from a very small biological sample and produce a confirmed result relatively quickly. But that test has to be ordered, and it will only be ordered if a physician has reason to consider hantavirus as a possibility in the first place. Which brings me to exactly what you should do with everything I have just told you. First, if you have recently traveled to South America, particularly Argentina, Chile, or the broader Patagonian region, and you develop flu-like symptoms accompanied by heavy fatigue and significant muscle aching, do not assume it is ordinary influenza. Go to your doctor or urgent care and explicitly mention your travel history. Use the words hantavirus and Andes virus by name. That information changes the clinical picture entirely and may prompt testing that would otherwise never be ordered. Second, if you are planning to clean out a basement, attic, garage, garden shed, or vacation property that has been closed and potentially accessible to rodents, take protective measures before you disturb anything. The CDC recommends airing out the space for at least 30 minutes before entering, wearing rubber gloves, and using a disinfectant spray on droppings before sweeping or vacuuming. Never dry sweep rodent droppings. The act of sweeping dry material is precisely how viral particles become airborne and reach the lungs. Third, know the specific warning signs that indicate a flu-like illness has crossed into emergency territory. Breathlessness that develops or worsens rapidly over hours. An inability to lie flat due to breathing difficulty. Dramatically reduced urine output over 12 to 24 hours. Confusion accompanying fever. Any of these in the context of a recent flu-like illness demands emergency evaluation immediately, not a wait-and-see approach at home. Fourth, if you are over 65 and have chronic kidney disease, reduced lung capacity, or any condition that affects your immune response, speak to your physician before any travel to regions where hantavirus is endemic. There is no vaccine and no specific antiviral treatment, but supportive medical care is most effective when initiated early, before the illness reaches its critical phase. The gap between a treatable situation and a life-threatening one is measured in hours once hantavirus enters its severe stage. I want to close by being clear about proportionate risk. The World Health Organization's current assessment is that this is not a global emergency on the scale of COVID-19. Hantavirus does not spread the way respiratory viruses spread. We are not looking at a pandemic scenario based on current evidence. What we are looking at is a serious illness with a devastating mortality rate in those who contract its severe forms, a real and present risk for specific environments and travel regions, and a virus that is particularly dangerous for adults over 60 whose kidneys and immune systems face it at a disadvantage. That combination is exactly why this deserves your serious attention. Comment below right now with one of 3 responses. Comment, traveled recently, if you have been to South America or another hantavirus endemic region in the last several months. Comment, sharing this, if you are sending this to someone planning travel or working in environments with potential rodent exposure. Or comment, want more detail, if you have specific questions about symptoms or testing that you want me to address in a follow-up video. I read every comment personally. If this gave you information your doctor hasn't explained, please subscribe. Next week, I'm covering 5 blood test warning signs that predict serious cardiovascular risk years before any symptoms appear, and most doctors never point them out to patients explicitly. I'm Dr. Matthew Carter. Take good care of yourself, and take the information you now have seriously.